Hi, I'm Shivakshi, working as an assistant professor in City University, Ludhiana. My today's topic is BLS, that is basic life support. So this is a very important topic for all the medicos to save a life. Even the layman should also know how to save someone's life and should know the basic steps of a BLS. So say if someone becomes unresponsive all of a sudden, then what will you do if there was no one around? So you should know the basic steps of BLS if you are a first responder. So through this lecture, I would like to talk about how to save or manage someone's life, even inside the hospital or outside the hospital as well. Because we can see victims anywhere, like in road accidents, in the hospitals, in the office areas, in our neighborhood as. So we should know how to deal with these situations and in these scenarios, and should know the basic steps of a BLS. So first aid. First aid is the first and immediate assistance given to any person with either a minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening, or to promote recovery until medical services arrive. So main three principles of first aid is to preserve a life, to prevent deterioration, and to promote the recovery. Now, according to recent studies, sudden cardiac arrest is rapidly becoming the leading cause of death. Cardiac arrest is defined as the inability of the heart to produce effective cardiac output, thus impairing the tissue perfusion. So, cardiac arrest may be of cardiac origin or non-cardiac origin. In adults, it is usually of cardiac origin, and in children, it is usually of respiratory origin. Cardiac arrest may be witnessed or unwitnessed. So, it may be inside the hospital or outside the hospital. Now, what is BLS? So, it defines the sequences of procedures performed to restore the circulation of oxygenated blood after a sudden pulmonary or cardiac arrest until they can be given full medical care at a hospital. So, it can be provided by trained medical professions, including paramedics, and by anyone who knows how to do it anywhere immediately without the use of any equipments. So, we should know how to give the basic first aid to a person whenever somebody collapses around. So what are the objectives of this topic? So how to assess the collapsed victim, how to perform chest compressions and rescue breathing, how to place an unconscious breathing victim in the recovery position. Now, what is the purpose of CPR? Maintaining circulation and oxygenation in order to maintain a cardiac output to keep our vital organs alive. And what is the goal of CPR? To initiate saving a life, to take rapid decisions, because irreversible brain damage may occur within 4 minutes of cardiac arrest. So you have to act very fast. So early assess, early CPR, early defibrillation, early ACLS, that is advanced cardiac life support. Now, management of CPR is basically done under three heads, that is basic life support, advanced cardiac life support, post cardiac arrest care. So whether the CPR is provided by BLS or ACLS, the primary focus is on the management of airway, breathing, circulation, and early defibrillation. Now, AHA has given 5-link chain of survival, that is early recognition and activation of emergency medical services, immediate CPR, that is cardiopulmonary resuscitation. So every 5-minute delay, it decreases the prognosis by 7 to 10%. You have to give early shock, because CPR plus shock within 5 minutes has survival rate of up to 49 to 75%. Early advanced life support, post cardiac arrest care to restore the quality of life. So here are the 5 key link chains of survival. So how you activate the emergency responses, then you have to give the high quality CPR, defibrillation, then advanced resuscitation, post cardiac arrest care, and then recovery. So indications of CPR. So CPR could be due to cardiac arrest, it can be due to respiratory arrest, or it could be a combination of both. So what is basically cardiac arrest? If there is no breathing, no pulse, and the patient is unresponsive, the patient is in cardiac arrest. And what is respiratory arrest? If the patient is not breathing but has a definitive pulse, then we can say that the patient is in respiratory arrest. So what are the causes? So Cardiac causes are MI, heart failure, dysarrhythmia. And what are the pulmonary causes? We have respiratory failure, airway obstruction, ARDS, that is acute respiratory distress syndrome, and then pneumothorax. Now, what is ABC to CAB? That is, ABC is airway, breathing and circulation, and CAB is, that is CAB, is circulation, airway and breathing. So whether the CPR is provided by BLS or ACLS, the primary focus is on the management of airway, breathing, circulation and early defibrillation. The standard age-long sequence of airway, breathing, circulation was changed to CAB, that is ABC to CAB, in 2010 CPR guidelines, which means that rescuer will first give 30 compressions in approximately 18 seconds before proceeding to the airway and breathing. Even the recent guidelines has shown that we can even continue with the chest compressions if someone didn't know how to give the rescue breaths, or if there was no one around you to help. Now, what is CAB approach? That is circulation, airway, breathing. Now, this is a common acronym in BLS which is used to guide providers in the appropriate steps to assess and treat patients in respiratory and cardiac distress. This is CABD, circulation, airway, breathing and defibrillate. Now, CPR is as easy as CAB, that is, you have to give chest compressions. So you have to give 30 chest compressions and you have to push hard and fast. Then you maintain the patient's airway, and then you have to maintain the breathing of a patient by giving mouth-to-mouth rescue breaths. Now, components of BLS. So basically we have to follow these steps properly to save a victim's life. So number one is scene safety. Second is you have to check for response. Third, call for help. Then fourth is check pulse and breathing. Fifth is 30 chest compressions. Sixth is 2 rescue breaths, and then seventh is defibrillation. Now, the number one step is ensure safety. So safety of self and safety of a patient or a victim. Say if, let's say if someone collapsed in the neighborhood, or say somebody collapsed or drowned in a water, then you don't know how to swim. So you, first of all, you have to save yourself before saving somebody's life. So in these scenarios, you have to save yourself. So ensuring the safety of both, that ensuring the safety of yourself as well as the patient or a victim, is the most important thing. So scene safety should be the first priority. Then second is you have to check for the response. So you have to shake the shoulders gently of a patient or a victim. So by asking him, hello sir, are you all right? So you don't have to be always like, in a medical language only. So if somebody says a layman, then you can't, and he didn't know the English or the language you are speaking, then you should know, speak in the layman. So you can say that Babaji, tusi theek ho? Then after that, if the victim responds, then leave him as you find him and call for help. Then find out that what is wrong, and then you have to reassess the condition of a person. So checking the response is most important thing before giving the chest compressions. So third is you have to call and shout for help. So you have to call and shout for help. Say if you are like inside the hospital, then we announce the code blue in the hospitals, and a rapid response team arrives with a whole team and who will manage the situation. And then if you say you are outside the hospital, then you call for the help and you ask someone to call for the ambulance. And then whenever you are calling somebody for a help, so you have to first explain tell him the exact location where the person or victim collapsed, right? Because this will remove the dismanagement. So this is how you have to check for the things. Then you have to check the circulation. So you check the patient for a palpable carotid pulse for 5 to 10 seconds. Do not check for more than 10 seconds. So you have to check the pulse and breathing simultaneously for about 5 to 10 seconds. So how will you check the pulse? So we always check the central pulse, okay? We don't check the peripheral pulses in these cases. So we check the central pulse, and we always prefer to check the carotid pulse. So how will you check the carotid pulse? So you will feel in your neck this hard part, this is throat, and just move laterally, and then you can feel your pulse. And this is basically done by saying 1001, 1002, 1003, 1004. So by doing this, you have to check your pulse for about 5 to 10 seconds. So 1001 means 1 second. And then simultaneously, you have to look for the breathing. So you keep your face near the victim's face. So you check the breathing, because some cases like you can't appreciate the chest rise of a patient. So you have to look for the breathing and circulation simultaneously. So look, listen and feel for normal breathing. Do not confuse agonal breathing with normal breathing. And if there is no pulse and abnormal breathing, then start CPR. Say if patient is unresponsive, there is no breathing, no pulse, then we start giving the CPR, that is cardiopulmonary resuscitation. So chest compressions, coming to how to give the chest compression. So this is the most important thing to initiate or to save someone's life. So to start CPR, so number one thing is you have to place the patient in the supine position on a firm and flat surface. So the surface should be flat. Whenever you are placing that patient, it should be flat. So kneel down to the patient and locate the position for chest compressions on a person's chest. Now place the heel of one hand in the center of chest and place other hand on the top. Then you have to interlock the fingers and then you compress the chest. And when you compress the chest, you have to actually keep the rate 100 per minute, and depth should be 4 to 5 centimeter. So approximately rate should be 100 to 20 per minute, and depth should be around 4 to 5 centimeter, and you have to deliver 30 chest compressions. So equal compression and relaxation should be there. And when possible, change CPR operator every 2 minutes if someone is there around for your help. So like this, we will give the chest compressions. Now, what are the good quality chest compressions? Or we can say that these are this could be a good quality of chest compressions. So you have to press hard and fast. Rate of chest compressions should be at least 100 to 120 per minute. Depth of chest compressions at least 5 centimeter. You have to allow the chest to recoil completely after each compression and minimize interruptions in chest compression, no excessive ventilation, and 30:2 if no advanced airway is in place. Means 30 chest compressions and 2 rescue breaths. So airway, how to maintain the airway and how will you open the airway? So after giving 30 chest compression, you have to open the victim's airway. So there are 2 maneuvers to open the airway. You have to keep keep the patient on a firm surface, and there are 2 maneuvers to open the airway: head tilt, chin lift maneuver, right? So you have to tilt the head of a patient and lift the chin of a patient. Then jaw thrust maneuver in the cases if the victim is, say, having spinal or cervical cord injuries. Then how will you deliver the rescue breaths? So you have to deliver 2 rescue breaths. So tidal volume, say, should be 500 ml, and respiratory rate means give each breath over about 1 second with enough volume to make the victim's chest rise. So you have to deliver 2 breaths in 3 seconds. Say 1 breath takes 1 second, so you have to give 2 breaths. So you have to deliver 2 breaths in an interval of 3 seconds, and your breath should be delivered in such a way that it would make the victim's chest rise. Okay, and whenever the most important thing is, whenever you are delivering the rescue breaths, you always have to pinch the nose of a patient. So pinching the nose is very important. Then methods of rescue breath: mouth to mouth rescue breathing, then mouth to nose, mouth to stoma ventilation, ventilation with bag and mask, and ventilation with an advanced airway. So say if you are in a hospital and you're ventilating a patient with bag and mask, so you have to follow the C and D technique. So you have to make a proper C and D technique, and then you ventilate the patient with bag and mask. Continue resuscitation until qualified help arrives and takes over and the victim starts breathing normally and rescuer becomes exhausted. So you have to continue the resuscitation till the medical help arrives. Now, what is AED? This is automated external defibrillator. An AED or automated external defibrillator is basically, it is a device, that has the ability to detect irregular heart rhythm, and it automatically delivers a defibrillation shock to stop irregular heartbeat and allow a normal rhythm to resume. So it basically detects the irregular heart rhythm. So AEDs are designed to be used by any layperson, so anyone can use the AED. It is basically designed in a very simpler way, so that a layman should also know how to use the automated external defibrillator. And a AED box contains an AED machine with battery and charger. Then we have 2 self-sticking pads with cables and connectors and 1 razor. So whenever you are delivering the shock, so the most important thing is when you are going to deliver a shock, eye clear, we clear, all clear is the most important thing, because no one should touch the patient whenever we are delivering a shock. So eye clear, we clear, all clear is the most important thing before giving shock to anyone. So here are the recovery positions. Then when victim starts to breathe, we take him to a safe place and in a recovery position. So you follow these basic 4 steps. You have to properly straighten the legs, and you just tilt it slightly, and you tilt your chin to drain out your secretions, so that whatever the secretions are there, so that it could be drained out. So we are just doing these steps to prevent the aspiration, right? So this is the simplified algorithm, how you are supposed to save someone's life, and how you are supposed to do the chest compression. So number 1 is if patient is say unresponsive, no breathing, or no normal breathing, only gasping is there, then you activate the emergency response and ask somebody to get the defibrillator, and then we start doing the CPR. You have to push hard and push fast, right? So you have to push hard and fast for approximately a proper 30 cycles till you deliver, right? So till 30 chest compressions you deliver. So push hard and fast till 30 chest compressions, and you have to give chest compressions at a rate of 100 to 120 per minute, and depth should be 4 to 5 centimeter. Then you check when the somebody comes and with the defibrillator, then you check the rhythm. If shock is indicated, repeat every 2 minutes. So when there are chances that CPR may fail, so CPR may fail if there is delay in starting, if our technique is wrong, and we forgot to pinch the nose when we are delivering the rescue breaths, or we can say that if there is delay in defibrillation and there is no ACLS or advanced cardiac life support to follow up, and or in situations when there is massive heart attack, or say some unmanageable diseases. And what are the complications of CPR? Rib fracture, internal injuries to the organs, laceration related to the tip of the sternum, vomiting and aspiration, gastric distension, and pneumothorax. So while giving the CPR, you have to keep some things in mind, that how can you avoid the complications. And now I'm showing you a demonstration of basic life supports, that how to deliver a proper steps of BLS. So number 1 is scene safety. So scene safety is very important. Scene safety of both the rescuer as well as for the victim also. So first of all, you have to keep the patient to a safer side. Say if like patient collapses on the road or in some road accident, so then you take a patient on a safer side, right? Or if we can say, as I already told you, that somebody is drowned in a pool water, then you don't know how to swim. Then in that cases or in that scenarios, so you have to save yourself first, right? And then initiate the saving of life. Then you have to check the response of a patient, right? So how will you check the response of a patient? So you always check the response of a patient in a layman language. So you always ask or tap on the shoulders, and you always tap on the shoulders from the front side, never from the back side, because patient might have some cervical injuries, right? So you always tap from the front side, that Baba ji tusi theek ho. So you have to repeat this thing 3 times, that Baba ji तुसी ठीक हो, बाबा जी तुसी ठीक हो. Then after that, if patient is not responding, then you call for help. So if you are inside the hospital, you will announce the code blue, or then a rapid response team arrives. And say if you are outside the hospital, then you ask someone to call the ambulance and then tell him the exact location where the person or the victim collapses. And then after calling for help, then again you come, and then what you do, you will check the pulse and breathing simultaneously. So how will you check the pulse? So we always check the carotid pulse. We can also check the femoral pulse, but we always prefer to check the carotid pulse. So what you have to do, you have to just keep your hand on the forehead of the patient, and then this hard part, so here you will feel the thyroid notch, and then you go laterally, and with 2 or 3 fingers you can feel your pulse. So you have to feel the pulse at least for 5 to 10 seconds. So you will say 1001, 1002, 1003, 1004, 1005. So you keep checking the pulse till 10 seconds, and then you can check the pulse with either 2 or 3 fingers. And then simultaneously, whenever you are checking the pulse of the patient, then you keep your face towards the victim's face, and then you heard the breathing sounds, right? So if there is no breathing and then no pulse, then or the patient is unresponsive, then we can start giving the CPR to the patient. So we'll start giving the chest compression. So first, what thing you have to do? So firstly, you have to see the draw the intermammary line imaginary. So you can see the nipple area. So this to the center of the nipple area. Then here you keep the heel of your hand, that is center of the nipple area and the lower half of the sternum. So you draw the imaginary line between the nipple areas and lower half of the sternum, and here you keep the heel of your hand. So when you are keeping the heel of your hand, then you have to interlock your fingers. Then you keep other hand and interlock your fingers and then your heel. So what you have to do, your elbows should be straight, right? Your elbows should be locked and straight, and your shoulders should be above the patient side. It should be on the patient's chest. And your so whenever you are giving the chest compressions, your back should move actually, and your elbows should not move, right? Your elbows should be locked and straight. So whenever you are giving the chest compressions, so these things you need to keep in mind. So now I am showing you how to give the chest compressions. Now I am giving the 30 chest compressions. So how you give the compressions? So keep the heel of your hand on the lower half of the sternum, that is between the intermammary line, and then interlock the fingers. Your elbows should be straight and locked, and start giving the chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So in this way, you will give the 30 chest compressions. So your compressions should be like that. You have to push hard and fast. That means that chest compressions should you deliver whenever you are delivering, it should be at a rate of 100 to 120 per minute, and your depth should be around 4 to 5 centimeter. Okay. So after giving the 30 chest compressions, then what you do? Then you secure the airway of a patient. You will deliver the rescue breaths. So whenever you are giving the rescue breaths to a victim, then what you have to do in that case is you have to tilt the head of a patient, and that is chin lift, head tilt and chin lift, right? So you have to tilt the head of a patient and lift the chin of a patient, and then you deliver the 2 rescue breaths in about 3 seconds, right? And when say in the suspected cases that you may be like that the patient might be having some cervical or spinal injuries, then in that cases or that scenarios, you won't do the head tilt and chin maneuver. You just give the jaw thrust maneuver, right? So you just do the jaw thrust, right? So now I am just here telling you how to deliver a breath in head tilt and chin lift. So you just tilt the head of a patient and lift the chin, and then you deliver the 2 rescue breaths in about 3 seconds. So you can give the mouth to mouth breath also, and you can also deliver the breath with say mask, right? So with mask you have to hold the mask with C and E technique, right? So whenever you're initiating or whenever you're delivering a breath, so your breath should be like that. It should initiate the victim's chest. So your victim's chest should be raised properly. Then after delivering this 30 chest compressions and then 2 rescue breaths, then again you come and continue with the 30 chest compressions. Say if someone is there around or near you for a help, then you can change your then the person who is giving the chest compressions, then he will go on the side that he will deliver the rescue breaths, and the one who is delivering the breath can give the chest compressions. But the high quality features of CPR should be maintained properly, because you have to minimize the interruptions. You can avoid the interruptions minimally, right? So whenever while giving the chest compressions, if someone say came out come and with a defibrillator, then we will attach the defibrillator. So how will you attach the defibrillator? So it should be it is designed basically in a very simple way that even a layman should also know. So you have to just attach a lead here, right? And then we have 2 pads here. So what you do, you just attach the one pad right below the right clavicle. So here you attach the pad, right, and the second pad should be below the left armpit, right? So it should be here. So then you connect the leads with the pads. The whole process quite be little fast. So you, after attaching the shock, you just on the defibrillator.
Analyzing heart rhythm.
So now the defibrillator is
touch the patient. Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now. Shock delivered. Start CPR. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now. Shock delivered. Start CPR.
So like when the shock is delivered, so what things you need to keep in mind. So whenever you attach the pad, right, what the defibrillator does, he just analyze the shock rhythm, right? So if it is a shockable rhythm, it will deliver the shock. So when the whenever you are giving the shock, so the most important thing is that you do not touch the patient. You have to stay clear from the patient, because whenever you are delivering, you always need to say I clear, we clear, all clear. So you have to be, everyone around the victim should be just a little far away from the patient, should not touch the patient. So everyone should be clear. So defibrillator does just say the little things. We have to follow that basic steps, and then just if it is an analyzable and shockable rhythm, it will deliver a shock. And when the shock is delivered, then again we can continue with our 30 chest compressions and 2 rescue breaths, and we can continue the cycle approximately say 5 till 5. That is, we can give the 5 cycles approximately, and after giving the 5 cycles, what you have to do, we can just continue with the resuscitation till the signs of a life, or till the ROS, that is rapid on-site evaluation. So this is how we can do the proper steps or follow the proper steps of a BLS. And I think everyone should know the steps of a BLS, and you feel better when you save somebody's life. So by initiating this, we can save somebody's life, someone's precious life, and how you feel good when you save somebody's life. Thank you.
Analyzing heart rhythm.
So my home message is that taking the right action quickly and confidently, you can make the difference between the life and death for a person dealing with cardiac or respiratory arrest. So now I would also show you the demonstration how to give the chest compressions and what are the proper steps for a BLS.